pain management. What comes to your mind when I say that? Now keep those things in mind while I read you these statistics. According to the National Institute of Drug Abuse, roughly 21 to 29% of patients prescribed opioids misuse them for chronic pain. An estimated 4 to 6% who misuse prescription opioids transition onto heroin, and about 80% of people who use heroin first misuse prescription opioids. Isn't that really scary? And according to the American Pain Foundation and a recent review, found that opioids at guideline recommended doses aren't even effective for people with low back pain. Plus, drugs are prescribed to deal with patients' pain as a first line of treatment. All of these statistics are because of the opioid crisis we're in, and it's all thanks to pain management. But have no fear, because I'm here to tell you that there are so many other options that we can use besides opioids. According to the Mayo Clinic, some of the other treatments include acupuncture and exercise, chiropractic manipulation, music therapy, yoga, and marijuana. Now, just so we're clear, this is not about how we need to legalize marijuana. It's simply just another way to treat pain, and if you're in a state where it's legal, then by all means, I really hope it helps. But the ones that we're going to be focusing on are acupuncture and exercise. Now, when people think of acupuncture, they instantly think, no way am I going to let someone stick a bunch of needles into my body and leave them there. Or they think it works only because they believe that it works, which is called the placebo effect. According to WebMD, acupuncture is an age-old healing practice in traditional Chinese medicine and works by placing very, very thin needles into specific points of your body. When these needles are inserted, they release the flow of your body's vital energy by stimulating points along your 14 energy pathways in your body. And when these pathways are opened, your body releases endorphins, which are your body's natural painkillers. That's crazy. And along with all of that, acupuncture is really good for blood flow and brain activity. So when you choose a doctor to perform acupuncture, they may ask you some questions that are related to where they're going to place the needles and where you're feeling the pain. According to the Mayo Clinic, this has developed over time for aspects of Eastern and Western medicine. For Healthline, a small pilot study was done in Vermont showing that 32% of people that take opioids have cut back increasingly due to acupuncture. Some of the most common things that acupuncture can be treated with are chemotherapy-induced and post-nausea and vomiting, lower back pain, carpal tunnel, arthritis pain, migraine and tension headaches, and even dental pain. Yes, I said dental pain. Research has also shown that along with massage therapy or other alternative medicine treatments, that there can be a reduction of drugs and it can improve the quality of life for people that deal with chronic pain. The other alternative treatment that we're going to talk about is exercise. Now, the most common reason why people may say this doesn't help them is because they try it for about a week and then just say it doesn't help. But just like anything else you do, this takes time. You may not be able to go run a marathon because your body's not used to physical activity, but I don't think anyone has ever gotten off the couch with a little bit of work and said, I think I'm gonna run a marathon today. Most experts say that you should work out for 30 minutes to an hour daily. And this can include yoga, a brisk walk, weightlifting, running, using the elliptical or Stairmaster, or even playing a fun sport. Physical activity can also benefit you in more ways than just helping with chronic pain. From WebMD, it can improve posture, give you a healthier heart, and also help with your mental health. According to the National Center of Biotechnology Information, some of the conditions that physical activity can help with are rheumatoid arthritis, osteoarthritis, fibromyalgia, lower back pain, along with so many others. And from personal experience, working out with a buddy is way better than working out alone. But remember those really scary statistics that I told you about earlier? Well, because of the high misuse of opioids and the growing popularity and research of alternative medicine, doctors are finally understanding the benefits and now prescribing these treatments instead of opioids. Now, just because I talked about these two doesn't mean there aren't any others out there. You should definitely do your research and consult your doctor. And along with that, don't stop taking your medicine or stopping your treatment because one, it can seriously damage your body, a lot worse than helping. And two, you should never ever stop anything without consulting your doctor. But just simply the next time you go visit your doctor about chronic pain, ask them about alternative treatment and what it can do to help you, because there are so many other options than just conservative medicine. But I don't know about you, but I definitely want to see those scary statistics go down. Thank you.